Heart disease is the #1 killer of women in the U.S. It's more deadly than all forms of cancer combined. That means 1 in 3 women will die of heart disease this year, compared to 1 in 31 deaths from breast cancer. But there are plenty of ways to reduce your risk. Here with some suggestions is my guest, Dr. Pam Taub, a cardiologist with UC San Diego Health Systems. And Dr. Taub, what's the biggest risk factors for cardiovascular disease in women?
Well, it's the traditional things that we think about: high blood pressure, high cholesterol, tobacco use, being overweight, being sedentary, and poor nutritional habits.
So we've heard of those before, and many of us are aware of the traditional signs of a heart attack: crushing pain, radiating pain down your left side. What are some specific signs that women might experience?
So heart attack symptoms can present very differently in women. Sometimes it's very subtle things such as fatigue or decreased exercise tolerance. So typically a woman will tell me, I used to be able to walk 5 miles last year, and this year I can only walk a mile. So more subtle symptoms.
And they can have symptoms in other places too, right? Like their back, neck, jaw. I mean, men can too, but it doesn't necessarily just have to be in your chest.
Correct. And the other commonly confused symptom in women is some of the sweating that they get with exertion. They sometimes interpret it as hot flashes, but a lot of times it can mean that there is a cardiac issue.
So this exertion element seems like a very important one. When should you call your doctor with these symptoms, and when should you call 911?
Well, that's a complicated question, because if a symptom is new and it's severe and it's debilitating, you should clearly call 911. For instance, if you wake up with crushing chest pain. But if you're having something more subtle, you're starting to notice some fatigue, decreased exercise tolerance, that's one where you can go see your doctor and get that addressed.
And they could decide whether it is something like a cardiovascular problem or something else. There's been a drastic drop in the number of people and women who smoke. What kind of impact has that had on cardiovascular disease?
Well, based on the recent statistics from the American Heart Association, about 200,000 of tobacco-related deaths are from cardiovascular disease. So with the reduction in tobacco use, those numbers of deaths should go down.
Now, you've said that there needs to be a shift of focus, not just lose weight, you're having chest pain, do these things. You said there needs to be a shift of focus when it comes to treating heart disease or preventing heart disease.
I feel there needs to be a fundamental paradigm shift in our health system. Right now, we're a very reactive health system in which we react to a problem, a blockage in an artery, and we put stents or we do surgery. We really need to be more proactive and preventative. I believe preventative cardiology is the next frontier.
Name a couple of proactive things we could do before we get to that point.
Starting from a very early age, in your 20s, looking at your diet, looking at how you can increase exercise, having your primary care physician really carefully monitor your blood pressure, your lipids.
And you're talking from in the 20s, early age. What are some of the latest treatments, though? You named some of them, but if somebody has had a heart attack or does have cardiovascular disease, what are some of the latest things we can do?
Well, there's a lot of procedures that we can do, of course, but statins, which are cholesterol-lowering drugs, are the cornerstone in our management of high cholesterol. There's also some new drugs that are being developed that will be reducing cholesterol that are currently in trials. But statins, blood pressure reducing medications, those are the cornerstone of therapy.
And we're talking about these lifestyle changes, but genetics plays a role too. What's the situation with genetics and heart disease?
Well, that's a very specific research interest of mine, because there's a lot of people that do everything right. And you look at them and you would never think that they would have a heart attack, and these people do. These are typically people that are exercising or running marathons that have a heart attack, and those people have a very strong genetic component. And those are people we're trying to understand better through research. So there's some new blood tests that are very useful in helping predict and identifying these people.
So if you have a genetic or family history or think you might, then there's a blood test for that. That's interesting. We have to wrap on this. You're the director of a new cardiac rehab and wellness center. Tell us, how is that going to help patients?
Well, at the new Jacobs Medical Center, which will be opening in 2016, on the ground floor we will have a cardiac rehabilitation and wellness center. And again, this is another way we're going to cause a fundamental paradigm shift in how we approach patients, from focusing on patients that need procedures to preventing. So in this new Rehab and Wellness Center, we will work on a lot of lifestyle modification. We'll have classes on nutrition, on stress reduction.
So sort of a whole look at it. And there's more about that on our website, kpbs.org. Dr. Pam Taub, thank you so much.
Thank you.